As a final question, Dr. Bay, you mentioned that we had made significant progress over the past 3 or 4 years. Take out your crystal ball, if you would, and tell me what you think the future might look like in 10 years.
As you mentioned, most of the progress in the last, let's say, decade has been in terms of biomarkers to help with the diagnosis of these conditions. The number of antibodies we had in 1990s were literally, you can count on your fingertips, and now those have increased exponentially, which has allowed us to offer all these antibody panels, which are helping clinicians in various parts of the world diagnose these patients, hopefully diagnose these patients early. What is lacking, despite all these advancements, is advancements in the area of treatment. We are still using the medications we were using back in 1990s in terms of immunosuppressive medications, and there's not been a lot of change. Partly because in those scenarios, those medications tend to work, and partly because we are still understanding the mechanistically how these syndromes are caused. So I'm hoping that in the next 10 years, with growing impetus and growing interest in research in the field, we will have a better understanding of the mechanisms contributing to development of these disorders. How these, as you pointed out, these killer T cells, why do they enter certain parts of the brain, and why certain antibodies are associated with certain specific syndromes, or certain T cells are associated with certain specific syndrome. What is the population of these T cells? Can we target a subset of T cells instead of suppressing the whole immune system when we are managing these disorders? Are there certain biologic therapies which could be utilized for managing these patients, which we have not looked into further? Are there ways, especially pertinent to immune checkpoint inhibitor related adverse events, are there ways where we can allow the immune checkpoint inhibitor to do its job as far as the cancer is concerned, but still prevent attack to the nervous system? These are all questions which I'm hoping with the research which is going on, we'll find answers to. And then also one area which I feel I'm personally very much interested in is understanding why some people get this and not everybody else. Can that help us treat patients, identify patients at higher risk, and then hopefully manage them accordingly at a very, very early stage? Also, by identifying those immunosignatures, can we stratify patients, especially those getting immune checkpoint inhibitors, and try to avoid development of these disorders?